just knowing that we're here and that it's real and that, I don't know, just breaking those barriers of stigma and that we do have a lot of people that openly communicate. We have staff members that are employed. We have people that are advocates for our services, but just knowing that we're here and knowing that HIV isn't a death sentence. It's not something to be ashamed of.
That was Sarah Phillips, Chief Medical Officer at Matthew 25. In this episode, we want to delve further into the clinical side of Matthew 25. So we spoke with Dr. Phillips as well as nurse practitioner Charlie Rhodes. Charlie is based at the Bowling Green office, and Sarah supervises all sites, but mostly based at the Henderson office. Matthew 25 is a healthcare organization based in Western Kentucky and Southern Indiana. It was started in 1996 by Sydney Burton, a nurse at the time moved by her Christian faith and a call to service. The organization serves those who are at risk for, living with, or impacted by HIV and other STIs through comprehensive healthcare, education, and support, while fostering community partnerships to combat stigma and to improve overall healthcare and quality of life. And who am I? I'm Stephen Hicks with the STD Prevention Training Center at Johns Hopkins, a CDC-funded regional training center within the national network of STD Clinical Prevention Training Centers, NNPTC. Thank you for listening. And now we'll hear from Sarah Phillips, Chief Medical Officer at Matthew 25.
So my name is Sarah Phillips, and I serve as the Chief Clinical Officer at Matthew 25.
How would you describe like the day-to-day operations or like doing the work, the clinical work, when it comes to folks in rural, spread out areas and various health needs that they may have?
Sure. So the rural health space is unique in that the opportunities for transportation, the access to healthcare, the literacy levels, the access to information related to good medical decision making. But I'll start with kind of transportation. Living in a rural area, people can travel an hour or two to get here. That places a heavy burden on their vehicles, reliability, their gas, and then making appointments that fit their schedule, whether they work, whether they don't work. The challenges of rural health, could be, like I said, the distance. It could be access to the services, things that are local to them. We have people that travel, like I said, an hour or two to get to us. Their local physicians aren't comfortable necessarily with maybe the things that they have going on, and so they come to us for HIV care, but also primary care. So we serve oftentimes as both type of providers, specialty HIV care along with primary care, managing chronic conditions like blood pressure, diabetes, acute things like bladder infections and different things. So we see that on a day-to-day. As far as getting to their appointments, we do challenge with a relatively high no-show rate at our clinics, whether it be, they've scheduled an appointment. Our systems do a pretty good job of reminding people of their appointments, but oftentimes they forget or they have something come up and they forget to call us or cancel or reschedule. So that is something that we heavily deal with, is kind of a no-show rate. But we have a process to help get them back on the schedule, back into care, help them not forget about their appointments, things like that. But the travel and the access to public transportation is very minimal at a lot of our clinics. Our Henderson location is probably the most rural. It's Henderson, Western Kentucky. We're right across the river from Evansville. The lack of public transportation is a pretty heavy burden here. Our Evansville location in Indiana does have a public transit that seems to be a little more convenient for people. The bus stops, the routes, they connect to our office a little more, a little easier. And our Bowling Green location seems to have a heavy population of people that use the transportation service down there that can get to our office utilizing the public transportation there. We provide bus tokens for the cities that heavily use those. Gas cards for people who use cards, the travel in cars. But that seems to be a lot of the biggest barrier for kind of the rural areas is transportation to their appointments.
Mm-hmm.
But
and thinking about providing HIV care. What does it mean to provide HIV care in rural areas, but also just like Kentucky, Western Kentucky or Indiana? And what does that look like when it comes to like a cultural, social dynamic?
We still have a large population of people that don't like to disclose their status, even to their closest family members, because of the, I want to say the conservative, atmosphere in a lot of where our locations are located. It still is heavily stigmatized and connected to a moral compass rather than a diagnosis like anything else.
Mhm.
So that's what we try to really break through with our education department is educating individuals on the reality of the diagnosis, and it's not, due to a moral issue. It's just one of those things, and so it is attached a lot to to values and morals where it really shouldn't be.
Thank you. And speaking of education, the education component and messaging, how do people feel about you equals you?
When we mention U equals U to people, a lot of times we educate them when they're newly diagnosed. That's the goal, U equals U. So, and what that means for them and their journey and their HIV care. And people are they're very hopeful and excited that U equals U is attached to it, and that undetectable is untransmittable, and I can have a relatively normal, if not normal, sex life and marriage and different things. It means that they're not, people don't know about it either when you talk about it. They don't know that that's attached to the diagnosis, and it's obtainable, and that it's the goal of HIV care.
Mhm. And also to kind of piggyback off the education, what do you want people in Western Kentucky to know about the work that you all are doing at Matthew 25?
I want people to know that the work we do at Matthew 25 affects more people than they know. It's oftentimes overlooked, and everything that a person living with HIV kind of encounters, whether it be, the lifelong journey of taking the medication currently and the struggles that they have, but just knowing that we're here and that it's real, and that I don't know, just breaking those barriers of stigma, and that we do have a lot of people that openly communicate. We have staff members that are employed. We have people that are advocates for our services, but just knowing that we're here and knowing that HIV isn't a death sentence. It's not something to be ashamed of. So I've been here about 8 years. It'll be 8 years in October. And so when I spoke to family about I'm going to go work at Matthew 25, this exciting work, this is what we do. And I even had family members say, "Well, do you have to touch them? Do you have to?" I'm like, "What do you mean? Of course! Like I would hug them if they needed a hug." It's just that misunderstanding that HIV isn't what we believed it to be 20 years ago, and that's the sad part. There's just a lack of education in what it is and all that. So just a fear. I would want to create awareness, and that ultimately breaks down fear of the diagnosis. So that's what I want people to know.
And what keeps you motivated? What keeps you inspired and keeps you going?
I think hearing from the people that we serve is always uplifting. We do make sure that we talk to the people that we serve. How are we doing? What are some things that you like that we do here? How could we improve? People that receive our services here, like I said, we solicit their feedback through surveys and focus groups and things like that. And a lot of the times it's very uplifting to hear how Matthew 25 has impacted their life positively.
Thank you. I was going to ask about success stories.
Yeah.
Uh,
Yeah. We have case managers here that are also nurses, and we have people that have walked with, especially limited English speaking individuals that may need some extra attention, some targeted education in their language that they speak, some education on the medicine, and some assistance, maybe creating a pill planner that, I open this one on Monday, I take it, but we've had people go to appointments with people, make sure that they understand their care and what it means. And we've seen people with AIDS diagnosis ultimately come back and they're undetectable and they have an immune system again and they're back to work and have good family connections where they didn't used to. And um, so there's a lot of success stories like that, and people are with us for 15, 20 years, of course they can be. So there's a lot of success stories like that.
Mhm. Could you describe the clinical infrastructure of Matthew 25?
Sure. So when it comes to the clinical infrastructure, we do have four clinic locations. We have Bowling Green, Kentucky, Evansville, Indiana, Henderson, Kentucky, and Owensboro, Kentucky. Each location is served by a physician assistant and nurse practitioners. We do have a doctor on staff that serves as the collaborating physician, kind of monitors the medical practice of the nurse practitioners and the physician assistants. But when a person calls for an appointment, they get on the schedule with nurse practitioner or physician assistant. We try to get them in relatively close, within 7 days of them calling us. And you probably know that a specialty that's difficult to get into, some rheumatologists and different things, it's 6 months to a year before you can get in. But we do aim to get people in quickly. Each of our locations has an in-house phlebotomist and a laboratory where people can get their labs drawn same day, so that we're not sending people from our office to another location to get their labs drawn. It's very convenient. We have medical assistants that serve as assistants to the medical providers. They take vital signs, they assist with vaccinations. We do offer immunizations in the office, things that are recommended for people living with HIV, like pneumococcal meningitis, HPV. We do try and offer an array of immunizations so that they can get them all here, and be protected from those. We have a mental health counselor at each location that does counseling in-house. We also offer EMDR services in-house as well. We have support groups at each location. Um, and then we have a clinic director that specifically at each location oversees the daily operations. So we have medical assistants, providers, phlebotomists, mental health counselors, and nurses on staff at each location. That's the clinic infrastructure. Now, there are other infrastructures when it comes to case management, support services, transportation, case management, all those things, but that's specifically the clinic infrastructure.
Okay. Well, thank you. Thank you.
Yeah,
I'm curious. So you said you're with coming up 8 years of Matthew 25. Were you doing HIV work before Matthew 25?
I was not. So I've been a nurse since 2011, and my nursing background includes emergency medicine. I've done some skilled nursing care, so long-term care. I've also done some home health services. I did not come to Matthew 25 with any HIV experience, but I did come with some administration background, managing teams, leading people. And so I actually was connected with Matthew 25 through a previous coworker. She was here and loved the work and loved the culture. And so reached out to me when I was in between jobs looking for something that, was meaningful. You want your work to mean something. I was in my early 30s and wanted some work that actually meant something and made a difference. And so I was hired at Matthew 25 and I haven't looked back. So,
Okay.
yeah.
That answer just made me think of like three questions. So I'm guessing the first one would be, how would you describe the workplace culture at Matthew 25? It seems very community oriented.
It is. So Matthew 25 as an employee is humble. It is very supportive of work-life balance, but also very mission and values driven. We have a mission that is at the center of the work that we do. And we also have values that each employee is educated on, and we learn how our work and the things that we do is tied to a value, how we treat our coworkers, how we go above and beyond to provide excellent service. We respect each other and our patients. And those values are kind of embedded in the work that we do, all the way up to Courtney, our CEO, that it expects us to work from those values and that mission.
Mhm. And I'm curious about if you could talk to younger Sarah before you got into Matthew 25, or even before you became a nurse. I'm curious, what would you want to impart onto her back then about what you know now?
I think when it specifically comes to things that I've learned while working at Matthew 25, or even in my journey, it would be to learn from the people that you serve. We don't know it all, right? As a new nurse, I probably thought that I kind of knew it all and I was going to save the world and and save everyone, but learning from the people that you serve and understanding that you have to work as a team too. You can't get everything done yourself. Um, Matthew 25 has taught me that the walk of life that I come from is oftentimes not the walk of life that others have come from. And so understanding where people are, meeting people where they are, and the people I've met through being a nurse at Matthew 25 and moving into the role I have now have really set me up for success and being empathetic in the role that I have and knowing that, I don't know, it's just, it's important work. And um, younger Sarah probably thought she was going to save the world and all of those things, but maybe I'm saving a little bit of the world in the work that I do and making a difference.
Is there a colleague that you would like to give a shout out to? Someone that just means a lot to you, supportive, or just a good listening ear?
You know, someone that I go to when I don't quite have the answer, or maybe I'm overreacting or don't, and I need to see a different perspective would be Courtney. I rely heavily on Courtney when it comes to listening and maybe giving me a different perspective, getting me out of my head or understanding that how I see it may not be the way it actually is, or maybe there's a solution outside of what I'm thinking. And so Courtney's a really good sounding board for me, especially in our time together in our one-on-ones when it comes to helping me understand how to handle a situation or something like that. But she gives me a different perspective that I need most times. And I
Mhm.
appreciate that about the work we do together.
And where do you see Matthew 25 in the next 5 years?
Matthew 25 has a lot of potential with meeting the needs of the community that we serve. We have the mobile clinic. I see Matthew 25 utilizing the mobile clinic to help reach the communities that we haven't been able to reach yet and getting people into HIV care almost immediately if we test in the community and access to treatment almost immediately. I see us also maybe growing in the area of STI care when it comes to, walk-in clinic appointments, being more of a sexual, health clinic and continuing our outreach in HIV and our hepatitis C and our PrEP outreach. Um, but I only see us growing. We've seen increased numbers in the last few years, and whether that be HIV or PrEP or a Hep C, but I do see us continuing to grow. But our outreach will grow with the mobile clinic for sure.
Mhm.
So I get the opportunity to really see quality as well and a different. So I help manage the quality program here. So the clinical quality management program, I manage the quality plan, I manage the data involved in that, the projects involved in that. So I see Matthew 25 from the humanistic, but also from like the data perspective. And so if you take a look at Matthew 25's data that tells the story, the work that we do is positively affecting those living with HIV. Our viral load suppression is above the national average at 92, 93%. But that's a culmination of everything that we do, the support services, the transportation, the food pantry, the clinical staff, the pharmacy. It's all a culmination of all the work that all of our over 100 employees do. But the data also I like to share that with staff, and I do share it with staff as a part of my role. But the data also suggests that the work that we do is improving health outcomes as well. So I'll add that
Yeah, yeah.
as a numbers for I don't know. It's not very storytelling, but just adding the fact that the numbers say that the work that we do also the patients convey it, but also our data does as well.
Well, thank you. Thank you.
So
Yeah, that's a very, very great detail to add. So thank you.
yes, you're welcome.
And now we'll hear from Charlie Rose. nurse practitioner at Matthew 25. And so is it okay if I call you Charlie?
Yes.
Okay, so Charlie, if you could, how long have you been with Matthew 25 and what is your title, your role?
Um, I've been with Matthew 25 for 3 years, and I'm the nurse practitioner in the Bowling Green office in Kentucky.
Mhm. And Matthew 25 has how many sites? Because I think I only went to the Henderson location.
A total of four.
Okay.
So, of course, Bowling Green, Kentucky, Owensboro, Kentucky, Henderson, Kentucky, and Evansville, Indiana.
And what makes Bowling Green stand out?
I would say we're very diverse here in our population. Um, it's it's very under-resourced. So there's a lot of barriers that our clients are facing. So compared to, I'd say, Owensboro and Henderson, I just think our population, they need extra care, if that makes sense.
Okay. And how do you make that? How do you meet that extra care?
Um, I, it goes to our values here at Matthew 25. We stay innovative, try to make improvements, stay on top of education. We give all of our clients love and treat them as an individual. Not everyone needs the same care. We support them, give them hope, let them know that, even if things are not where they want it to be or how they, you know, expect them to be right then and there, that, there are brighter days and things are going to change. Um, and then we collaborate with other organizations in the community because they can help support us to provide other resources for our clients. And then we just try to stay on top of our services and our education to best meet their needs.
Mhm. And that I think segues perfectly into the various I'm going to say the challenges, but the successes and challenges of the day-to-day work. Um, how would you describe those successes and challenges?
Um, the challenges are, we never know what someone is, going through. It may be hard to, like, say, for example, take your medication daily if you know, do not have a roof over your head, if you don't have food. And so that's where we come in at Matthew 25. We help to provide those resources. Um, we can help with, housing, we help with transportation, we help with food, um, just overall trying to keep them healthy and motivate them to, keep undetectable, and which is our main goal to, stay undetectable so we don't transmit HIV.
Mhm.
So you've heard that saying, you equals you,
Mhm.
undetectable equals untransmittable. That's our goal.
And how is that messaging? Does that messaging seem to translate well?
It does over time, I believe. Once I feel like when I make those connections and gain their trust, and that's a rewarding part to see their progress and to know that, hey, we're on the same page and we're committed towards the same goal.
And thinking about Bowling Green, would you consider that to be like a rural setting or an urban setting?
I would say more of an urban setting.
Okay. Okay. And from like a Matthew 25 perspective, how do you all I would say curate or tailor your services from a urban versus maybe not versus, but like a urban slash rural dynamic? If that makes any sense. Like if the people in various settings, I'm thinking like if in a rural setting, Places might be spaced out, so transportation might be an issue getting to and from. Public transportation may not be as readily available, or maybe a little bit more sporadic. But then in an urban setting, you have more concentrated people, more volume of people, but maybe still under resourced, like you were saying earlier.
So of course we have vans where we can transport, but then also here in Bowling Green, they have the public transit. So we can help provide the money that they need if they don't have it, or vouchers for their transportation. And then also, you would think that Uber is everywhere or Lyft, but in some of those rural areas, they don't have that. And of course, we do have that here.
Mhm. Has there been any sort of change or evolution over the years of who clients are or patients are? In the early days of HIV, it seemed as if it was a lot of cis male gay men. And then as time went on, other people, like more numbers of other people were impacted. Is there any sort of I don't know, range or groups in various populations, or is it just a diverse rainbow coalition of everyone?
I think it's just, like you said, diverse rainbow coalition. I mean, it affects everyone.
Mhm.
And that's why it's so important, some of the preventatives that are out there that we try to promote, like our PrEP, um, because that helps prevent HIV.
Mhm.
Because anyone can contract HIV. It's not, just for one population or one group of
Mhm.
individuals.
And in looking at prevention, thinking about like even when it comes to like STIs and such, how is that messaging? Because I know you spoke on U equals U, but are folks receptive, or what are some of the successes or challenges, or some of the messaging around STI prevention?
So for the clinic here, we have, I guess, is it two people that go out and they go out and speak about prevention. Um, and we offer, I guess it's not basic to everyone because it's not at everyone's hands, but we offer like condoms. We offer the education, hey, come on in, get tested, free testing for HIV and hepatitis C. Um, and then what else do we have? Of course, like I said, PrEP, and then there's DoxyPep out there now. I don't know how many people are aware of that. I know that some, you know, clients that we have that come in just for PrEP, like they've never even heard of that.
Mhm.
And from what I've seen, I don't have numbers, but what I've seen personally, it's DoxyPep has cut down on STIs on the HIV patients that I serve.
And if I may, I wanted to ask, what does the conversation or introduction to DoxyPep sound like? I don't know if you have like an elevator pitch, but like when you're talking to someone that comes in, what do you tell them about DoxyPep?
Okay, well, first I just asked them, have you heard of DoxyPep? Because before a patient comes back, client comes back to me, I see this questionnaire that they fill out, and it's asking their sexual health. So it lets me know like how many partners they've had in the last 12 months. It lets me know, if they've been exposed to STIs in the last 6 to 12 months. And so, asking them, hey, have you heard of this? And, I'm looking and I see that you've had this many partners and you've been exposed to this many STIs, you know, um, what do you think about taking the step to, number one, try to make changes with your sexual practices, but also having this DoxyPep on the side if you need it?
Thank you. Thank you for that.
Sure.
And thinking about taking comprehensive sexual health histories, I'm curious, as a nurse practitioner, I have nurse practitioner colleagues and such, and that we talk often about taking these comprehensive approaches. How would you describe your style of building rapport, building trust to be able to receive information and then be able to disseminate whatever resources you have available?
Um, I feel like I'm just very direct. And then just open, honest. Um, and then I can just sit back and listen. And then we can just try to come up with a plan together. Because my plan is not always going to work or fit what you have in your mind, but we can come up with something together that'll fit, you know.
Mhm.
But I guess the biggest part is just listening and trying to meet their needs.
How is it providing services with areas that might be a little bit more on the conservative side and maybe less um no, it's not San Francisco, I guess.
Yeah. So it's challenging because there's a lot of stigma out there. I mean, you would think that we're still in the 80s. It's just a lack of education. And those that do know, I feel like are afraid to speak up because of the judgment that they'll receive, and they don't want to be grouped into with others. Um, even thinking about prevention, I may want to work and try to prevent HIV. That doesn't mean that the next person does, because then they think that, oh, maybe they're a part of that group. Does that make sense?
Mhm.
Yeah. So it's just the stigma. It's heavy, and our patients experience it a lot. Even going outside of our facility, say just to go see a primary care provider or to go to the dentist office. Like they don't want to go because of the stigma. They would rather receive all their services here, um, because they feel comfortable and they feel loved here, and accepted. And they definitely do not feel accepted everywhere. So it's a huge challenge. We got a lot of work to do.
Mhm. And also thank you for the work that you are doing.
Sure,
Um,
sure.
and in thinking about the stigma that may that's out there, but within Matthew 25 there seems to be a very strong culture of care. How would you describe Matthew 25 as a staff member, but also as a person who seems to be a part of the community, the larger community, and bringing other people into the community?
So I feel like this corporation, everyone is focused on the same goal. Here to care for our patients every single day and to give 100+%. Um, we know that no person is the same, and we try to treat everyone holistically. And I feel like that's in within every department, not just me treating patients. I feel like it's the same way, like with our case managers, um, even someone that's educating on nutrition, or even our receptionist. Everyone is focused on the same goal.
I'm wondering, what would you want people that are not within the Matthew 25 orbit, folks who are not familiar with the work that you're doing, what would you want them to know about Matthew 25? And what would you want them to know about the work that you do with Matthew 25, supporting, advocating, caring for folks living with HIV, just living, period? What would you want them to know?
Um, I would want them to know that just because you're living with HIV, it doesn't mean that you're different from anyone else. Um, I don't know. It's not like you can contract HIV just because you're speaking to me. It's not going to rub off on you. Um, I would want them to know that, you know, I don't know. I would want them to know more about what HIV is, how the treatment and therapies are now, that it's okay to support others that have HIV, just like, that we do here at Matthew 25. I think that's what it all comes down to. Because our patients really, really depend on us. And I feel like here we're committed every day. And it wouldn't hurt for others to be aware of what we do, like more, because we're out there. But like say you're out in the community and like what Matthew 25 does. And if someone else is speaking on, maybe HIV or prep for prevention, then maybe you as an individual being educated and knowing could actually speak up and speak out also, um, to support those living with HIV and trying to help prevent HIV.
And on a personal note, how do you stay motivated? How do you stay like focused on the mission along with everything that, with life?
It's just very rewarding because to come in here and see that I've made a difference or an impact in someone's life and they could possibly, say they were in one headspace when I first met them, but now we've done a 180 or a 360. And I know that, hey, these steps that you've taken and we've taken together could possibly, help you live longer. And you can, that gives you more time with your family and just them feeling good about themselves and seeing that change. It's just very rewarding. So it makes me just want to come in here and do it all over again every day.
And also thank you for that. And of course, confidentiality is paramount. But I was
Sure.
curious about like success stories, thinking about how rewarding the work is. Is there a story or is there like a particular scenario, of course, with respect to confidentiality that provides you with an anchor of like, I did that thing. We did it together. We supported a patient, we supported a group, we supported a family
Mhm.
through a particular process.
So I don't know if you're familiar with viral loads.
Yeah.
That is okay, like the count of HIV in your in your blood. And so for me, I guess when I first started, my biggest one, like year two, getting someone undetectable, that just was not compliant with medications since the start of diagnosis. So like for that person, it was like going on 5 years, being diagnosed with HIV. But then that patient and I working together within 2 years, we finally got him undetectable, and taking his medications daily. And I just feel like he finally got it. It was tough at first though. And then it just broke one day and our conversations got better and he's on the right track. And I learned from him as well. I mean, they don't just come in here and listen to me. I learn from my patients as well. So
Mhm.
those are success stories to me because it just helps them to live longer, healthier lives.
And before you came to Matthew 25, were you as steeped in HIV care?
Not at all.
Okay.
I didn't even know Matthew 25 exists
Mhm.
until I was doing my practicum for nurse practitioner school. When I actually worked at a hospital down the street from Matthew 25, I did not know it existed.
Mm.
Hmm.
And if you could go back and talk to a younger Charlie, what would you tell her about HIV and HIV care?
Prevention. That would be the first thing. And talk about ways of transmission. And then really, really, really talk about how it affects everyone. That's the biggest problem that I see, that everyone thinks that it only affects certain groups. It affects everyone. Yeah.
Is there a teammate or a team member of yours that you want to give a shout out? Someone that supports you on the daily, or is your rock, or an example, or somebody that you look to as far as like that that accountability to stay on mission and just another support in the office?
What can I do too?
Sure, sure.
Okay.
More the merrier,
So my first one would be uh, my colleague that trained me. His name was Bill Kalin. He passed away here recently. And his passion and drive for HIV, his education commitment, it unimaginable. So that would be my first shout out. And then my second one would be to Sarah Phillips. Um, she is actually my director, but I feel like she's my person as well. I could pick up the phone and just tell her anything. She's going to listen to me vent. We have one-to-ones here where um, they want to make sure that Matthew 25 wants to make sure that your needs are met, and if you just have any ideas, anything. Um, when we have our one-to-one, I always have a list, and Sarah's just so patient and just listens to me. And, it could just be that it needs to be a 30-minute session, but it might turn into an hour or an hour. But I mean, she's dedicated, and when you see someone else that's dedicated, committed, and supports you and encourages you, it just makes you want to go even harder.